10:15. Can I just ask all the families that are sitting on my right of the stage on the blue tables to move right in the middle, as that side is used for the sisters' side, if you don't mind, please. Just before we begin our evening tonight, I would like to remind you that we have a free children's program available for you for this whole hour of presentations. So please ensure to drop off and pick up your kids, for this time while we'll be in here presenting. It's right in the cafeteria, room 1, so please feel free to drop off your children there. If there are any allergies with your children, make sure you advise the sisters who are volunteering there, inshallah. Let's begin our evening with the words of Allah subhanahu wa ta'ala, recited and translated by our 2 new adorable young brothers. Without further ado, here is Ahsan Kaleem and Muhammad Ahmed Kaleem reciting and translating ayahs from Surah Shams.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والشمس وضحاها والقمر إذا تلاها والنهار إذا جلاها والليل إذا يغشاها والسماء وما بناها والأرض وما طحاها ونفس وما سواها فألهمها فجورها وتقواها قد أفلح من زكاها وقد خاب من دساها كذبت ثمود بطغواها إذ انبعث أشقاها فقال لهم رسول الله ناقة الله وسقياها فكذبوه فعقروها فدمدم عليهم ربهم بذنبهم فسواها ولا يخاف عقباها.
By the sun and its brightness, and by the moon when it follows it, and by the day when it displays it, and by the night when it covers it, and by the sky and he who constructed it, and by the earth and he who spread it, and by the soul and he who proportioned it, and inspired it with discerning its wickedness and righteousness. He has succeeded who purifies it, and he has failed who instills it. Thamud denied their prophet by reason of their transgression, when the most wretched of them was sent forth. And the Messenger of Allah, Salih, said to them, do not harm the she-camel of Allah, or prevent her from entering. But they denied him and hamstrung her. So the Lord brought down upon them destruction for their sin, and made it equal upon all of them. And he does not fear the consequence thereof.
Jazakumullah khair, and that was indeed captivating. So we all gather here today with a heavy hearts and somber mood from the events that have taken place recently in the world around us. From today, in every salah, let's make an earnest dua for Allah's mercy. May all the unrest and resulting tragedies subside quickly. Ameen. Let's welcome our presenters without further ado. With our first presenter of the night. These very professional people are members of Muslim Medical Association of Canada, and there are very few medical professionals who in today's society do not overshadow a very important topic, of mental health. Whether you're aware of it or not, mental illness affects each and every one of our lives. One of these doctors is a clinical and research psychiatrist at the Center for Addiction and Mental Health. He completed his psychiatry residency, mood and anxiety fellowship at the University of Toronto and a fellowship in addiction psychiatry. He's a certified psychiatrist by the Royal College of Physicians and Surgeons of Canada and the American Board of Psychiatry and Neurology. Our second doctor, who will be speaking at the same time alongside him, she is also a psychiatry resident at the University of Toronto, currently at Women's College Hospital. She completed medical school in Calgary and her Master's of Science in New York. She's interested in child psychiatry, mental health in the context of Islam, and addressing barriers and stigma to seeking mental health treatment in the Muslim population. At the same time, brothers and sisters, there are too many clinics happening thanks to MMAC on the side of the stage. We have brothers on the very left side of my hand, and we have sisters to help you on the very right side of the stage. So they will be here to help all night, okay, with any questions you may have. They also have a lot of information on mental health programs that are offered in GTA. Please do go and see them and visit them and talk to them. They do not bite. They are very friendly. So without further ado, I would like Dr. Hassan and Dr. Arfeen to please enlighten and give us a very informative presentation now.
I see a lot of smiley faces, so it's very nice to see so many people in the crowd. If those who are at the back would like to grab a seat, we're going to, inshallah, get started. In our talk, we have a few kind of questions, so we'd love you guys to participate in our talk, and it's supposed to be interactive, but we'll kind of limit the questions to our booths. So if you could visit us at our booths, that would be great, inshallah. So just to begin with, this is Dr. Ahmed Hassan and my name is Dr. Arfeen Malick, and we're going to present on depression and mental health. So we just wanted to start by going through the components of wellness as according to their Islamic principles. So in Islam, actually wellness is divided into three things. So we all know we have Islam, which is the small I, which is the practice. And that has to do with your body, so the worship that you do, prayer, ablution, wudu. Then you have things like your mind, which is your iman, so your faith, so what you believe in. And then the other aspect of it is your soul, so that's ihsan, your spiritual cultivation. And it's very interesting that these principles, as laid out by the Prophet ﷺ, actually correlate very well to psychiatry, which is what I'm here to talk about. So your body, it's your physical health, so your Islam. Mental health is your mind, so your iman, your faith. And your spiritual health is captivated by your soul, so your ihsan. So these three things combined actually are what are the components of wellness in Islam. So what is mental health? What does that mean, the iman, faith, the mind part of it? So mental health, according to the definitions of the World Health Organization, is a state of well-being in which every individual realizes his or her own potential and can cope with the normal stresses of life. They also have to be able to work productively in society and fruitfully, and to contribute to society. And it's very interesting because this is actually the definition of the Prophet ﷺ. To be able to do these things in your life is what it means to be a complete and productive Muslim. So this also reflects the definition that we have today for what it means to be mentally healthy. So we're just going to go through some true or false to make this a little bit interactive. So how many of you think depression is the same as sadness? So true or false? Raise hands for true. Got 1, 2, 3, 4. Okay, great. And how many of you think depression, it's false, that depression is not the same as sadness? Okay, so a lot more. Okay. So I hope this talk actually is able to inform all of you just about depression, because that's what it's supposed to do. If we don't answer any questions or you have any thoughts, reservations about it, please come to visit us if it's not clear. But the answer is actually, it's false. So depression is very different than sadness, and sadness is a component of depression actually. So Dr. Hassan is going to go through that in a lot more detail. But what I thought was very interesting is that we actually have a hadith in Bukhari and Muslim, and it says, a Muslim is never afflicted with pain, illness, anxiety, sadness, sorrow, even being pricked by a thorn, except that Allah subhanahu wa ta'ala expiates sins by it. It's very interesting in this hadith, and many other hadiths, and actually in areas of the Quran, where there's a differentiation between sadness, and there's a differentiation between sorrow. And actually, worse forms of sadness are differentiated in the Quran. And many of the Prophets, they actually experienced forms of sadness, and Allah subhanahu wa ta'ala warned them against what's greater than that, so a sorrow, so a deeper sadness. So I'll let Dr. Hassan take over now.
Alright, so I think you guys can hear me. So as Arfeen mentioned, depression is not just about sadness. Well, sadness is definitely a component of it, but depression can be more like that. It's a complete disorder. It's a syndrome that consists of many symptoms.
I don't think they can hear with that mic. I'm going to switch over.
Oh, they can't hear. Alright, so another little quiz or question. So depression is due to a lack of faith. How many of you guys think that's true? Slowly increasing. Alright. And how many think that's false? That's not true. Alright, so the majority is right. Like depression is not due to lack of faith. This is a common misperception that we as Muslims have, that lack of faith, a person without a good connection with God, does not have any faith, does not believe in a good iman, has depression. But unfortunately, this can be part of it, but it's not all true. So a common misperception that's been found by Muslims, the identification of the causes for depression is that depression is caused by magic or sihr, as we mentioned. Depression is an evil eye or envy. Depression can be caused by wiswas or whispering. So all of these are, like, we all believe in this, and this is truly in the Quran, and we believe in all of it, but and it definitely can cause symptoms like depression, but it's not all-inclusive. So a lot of the depression symptoms can be very similar to a person who has sihr or had been affected by an evil eye. So therefore, we have to take it very seriously and be examined very carefully by a medical professional. So not everybody have depression has been affected by a magic eye or whispering waswas. Another question: how many of you guys think that depression can be genetic? How many think it's true? Depression can be genetic, can be transmitted from one generation. You can inherit depression from your parents. Okay. All right. So slowly increasing, and that is true. So depression can be genetic. We found in a lot, if you have a first-degree relative being affected by depression, your risk does increase. Same thing applies for anxiety and other disorders. So that just shows how strongly it can affect the biological reason. And we can understand depression by a really complex of multiple factors, multiple levels. We can't just say that genetic is the only cause, and we can't say person with lack of faith is the only cause, or we can't say that a person has been affected is the only cause. It definitely can be level or many factors that can come from biological factor, psychological factor, or social factor. And I'll talk more about these in details in a bit. So, when it comes to biological factor, as you can see, there are many biological factors that can cause depression. One of them already talked about it is genetics. Certain genetics, if we inherited them, we can make us vulnerable to cause depression. And so if we have these genes, it doesn't mean that we automatically will get depression, but it definitely makes our threshold to tolerate or cope with stresses much more harder. Thyroid disease, anemia, vitamin B12. So all of these are biological. We're proven that it very much links strongly to depression. Again, if you have one of these, it's not necessarily that automatically you will have depression, but it can definitely increase the risk. And that's why we take it very seriously and just show how deeply, strongly related the depression with other medical disorders. This is just a picture of the thyroid, where the thyroid is, and hypothyroidism or even hyperthyroidism. Both of these disorders have been found very much. A lot of people who are affected by hypothyroidism have depression and can present with a lot of symptoms of depression. One of the other also very common symptom is the chronic pain. A lot of people who are suffering from chronic pain can suffer from depression and a lot of symptoms of depression. So what causes depression? So you hear this a lot in the media and elsewhere, that depression is a medical imbalance, and this is partially true. It's a lot of the chemicals in our brain. So our brain consists of like billions and billions of cells, and enable for these cells to communicate with each other, they need chemicals like neurotransmitter. Some of these neurotransmitters, like the serotonin, for example, have been found to be decreased in people who suffer from depression. So this is just to show you how biologically the depression affects the body very, very strongly. Another thing is the increased stress, the increase the cortisol hormone. Everyone who gets exposed to trauma or any stressful situation, automatically their cortisol level increase, and that's part of our body to adapt with stress. Fortunately, our body can compensate for that and try to lower the cortisol level on the short term. However, if we get exposed to the stress for a longer period of time, and this has not been resolved, our ability to decrease that cortisol level will be affected, and depression can be a cause of this. Okay. And then we talked about the biological factor, and as I show, one big circle that can contribute also to depression is a social factor. So there is a many big list of social factor that can expose a person or make a person more have a potential of developing a depression. One of them, a history of childhood trauma. This is a big one. We find it almost in a big proportion of people who have been defined as depressed. Exposure to abuse of others, domestic violence, bullying at school, that's a big one too. Social isolation, stressful factor. Again, I just want to emphasize that not everyone exposed to these levels will have depression. However, the combination of biological, social factor and the psychological factor of how people experience it makes a person vulnerable to depression. Again, psychological factors like loss of self-esteem, unhealthy coping skills that could be using of substance to relieve the stress, including nicotine or cigarettes or alcohol, unresolved conflict between a man and wife, or conflict in a family. If that continues for a long time, that will be a prolonged exposure to stress, and that can increase our potential to have depression. Isolation, specifically social isolation, history of other mental health disorder, and by that we mean like if a person have an anxiety disorder, he can also be increased the risk for depression, and vice versa, other factors as well. So again, this is just to recap of what we said. Depression is usually caused by different factors: biological, social, and psychological. One is not usually strong enough, but having multiple factors at the same time can significantly increase our risk for that. So, one important thing that we really need you guys to get out of here is, or get out of this talk with, is a sign and symptoms of depression, because this is kind of important, and it's not just sadness as most people think. So, one of the symptoms, and again, this is not all-inclusive list, but this is some of the symptoms that a person can present with. If you know or have some of these symptoms, please see your doctor as soon as possible, because we really need to see or evaluate the case by case. So one of these symptoms is feeling worthless or feeling guilty, feeling helpless, having a short temper or feeling very irritable. That usually will substitute for a feeling of depression. So a lot of people have trouble saying that I'm depressed or I'm sad, and I can present and feeling irritable, and that can be noticed by other people around him. Loss of appetite or overeating. So a lot of people in depressed, depends on the individual. Some eat a lot, and some don't eat at all. And the same thing happens for the sleep. Some sleep a lot, and some don't sleep at all. Those are the common symptoms of depression. The lost interest, and that's what we call anhedonia. So the lost interest in their hobbies. Anything that used to bring them pleasure in the past, they lost interest in it anymore. They don't feel, so if, for example, if they used to like soccer, or they used to like basketball, they used to like family gathering, and then all of a sudden, not all of a sudden, but gradually with the depression getting worse and worse, they lose interest in it. They say that it doesn't bring me pleasure anymore. And so that's a good point. So even salah. So a lot of Muslims, specifically in salah, they can enjoy with khushu' and remembering all the words. They all of a sudden, with the depression, can interfere this ability to connect with God. So they don't feel the joy coming out of salah. They don't want to go to a mosque anymore. They don't want to go to any gathering. They don't want to see anybody. And that's called social isolation, which can lead. So this is another very common symptoms of depression. Insomnia, we talked about it. Continuous sadness, anxious, feeling hopeless or pessimistic about the future, feeling saying something like, there's no future, I don't see any light, what's the point of all of this? That's very common. And then thoughts of suicide. I know a lot of my Muslim patients and clients, when they hear the word suicide, they say, oh, it's not going to happen to me. Definitely religious can be a protective factor for suicide. However, it can present in a different way. So a lot of the people get affected of suicide, they don't specifically, or they get affected by depression, they don't specifically think that I want to kill myself, but they kind of tend to think of, I wish that I could go to bed and never wake up, or I wish that God would take my soul right now. So all of these wishes and a persistent thought of death can be definitely represent depression as well. Yeah, so there is one hadith that one of our previous presentation, one of the brother asked us if the Prophet ﷺ, when he said, don't, I don't remember the exact wording of the hadith, but don't wish suicide, or don't say that I want to die, that wish that, or the exact word of it is, if God please, well, I don't remember exactly the wording of it.
I think basically there's a hadith that says don't ask to be kind of hastened towards Allah subhanahu wa ta'ala, like don't ask for that time to be shortened, in a negative way, but say that Allah subhanahu wa ta'ala, if it is right for me, that will happen for me, and if it's not, then it is not the right time. But to actually wish and actively ask to be taken back to Allah subhanahu wa ta'ala is not actually from the teaching of the Prophet sallallahu alaihi wasallam.
That's not exactly wishing that the Prophet ﷺ wanted us to teach us the acceptance of God's faith. So, but it's extremely opposite to someone wishing like that, or wishing that I really wanted to die, and asking God to take his soul out. Again, so this is just a summarize of all the symptoms that we talked about. Many patients have many of these symptoms. All together and for a long period of time, and the key thing about depression, it will affect our functions. So a person with depression will not be able to function anymore. If he's at school, he will not be able to attend school, or his grade will significantly impair. If he's working, he won't be able to function at work. People around him will notice. Even he might even do all of these things, but endure a lot of distress, which is obviously will on the long term affect his function or her function. Okay, that's exactly what we talked about.
So we just wanted to talk about some of these statements. So I'll read them out to you, and I'd like you to just think about them, because these are things that we hear very often in the Muslim community when we have conversations about depression and mental health. So we often hear, you shouldn't be thinking like this, that's haram. You should strengthen your iman and pray more. It's all in your head. It's shaitan that's putting the thoughts in your head. Just think positive, and this is a test from Allah subhanahu wa ta'ala. So what do you say if someone actually does come to you and they, those are kind of responses that actually are not very beneficial for a person, because they don't help them in the situation that they're facing. So we thought about what could you say instead? What are things that might be actually quite helpful to a person in that situation? So, one thing that you could say is, you're not alone in this, I'm here for you. So as brothers and sisters in Islam, one of the most important things is actually giving good nasiyah, giving each other good advice, guiding each other towards what's right. So being there for someone, if they're very isolated socially, that can make quite a huge difference. You could say you may not believe it now, but the way you're feeling will change. So actually instilling some hope in someone, when someone has depression, when they seek treatment, actually things do improve and things get a lot better. So they might not be able to see it because they're thinking quite negatively, but if you're able to say that to them and you're able to give them some hope, that can be quite helpful. You can also say when you want to give up, just tell yourself to hold off for 1 minute, one more day or hour, or whatever it is that they can manage. Because often when people suffer from depression, the thoughts are so negative and so bad, they're quite tearful for much of the day, and even just being there and telling them this can be quite helpful. And then if it gets to a point where you really are concerned about a person, and it's very difficult for you to connect with, to get help from a psychiatrist or from your family doctor, take them to the emergency department. That's actually what the emergency department is there for. If someone's really struggling at home, you can take them there. And if you have questions about that, because I know many people have fears about what it means to come to the hospital, please come and ask us. So this is a true or false again. Medication is the only treatment for depression. So who thinks that's true, that medication is the only treatment for depression? Nobody thinks that's true? Maybe I'll give you guys a few minutes to think. Anybody think that's true? False. Okay, we've got some strong false. Okay, so how many of you guys think it's false? Many of you, all of you almost. Okay. That is the correct answer. Medication is not the only treatment for depression, so good job. So we want to talk about treatment. So what does treatment look like if it's not medication?
Okay. So I think majority of the hall here said that's false. So what do you think? If it's not medication, what else is there? How can we treat depression?
Change of environment.
Change of environment.
Expanding your social circle. Stuff
Okay.
like that will give you something different.
Okay, so it sounds like you're trying to refer to, so what's the causes, and we try to reverse the causes. So that's very good, so that you can do that. So what if that didn't work? What else we can do? So with the therapy, very good. Okay, so now we're talking more deeply. Okay, good. Anything else? Okay. That's good enough. So working on the environment, that's very good. Therapy, and I think we talked about the medication. This is like a very good combination. There's more to that, by the way. There's many forms of treatment that we do actually at any center, any hospital, or any center to treat depression. We do, but this is a very good summary.
So I was just saying, the reason why we asked you what you would do if you were suffering from diabetes is because, as you know, when you have diabetes, you you go to your physician, I hope. You guys go to your doctors and you get diagnosed with diabetes. Then the doctor will tell you, well, actually there's a lot of different things that contributed to your diabetes, including your lifestyle, your nutrition, but also, we need to actually treat the diabetes with medication or, whatever it is. Similar to that, depression is no different than any other medical illness. So in the same way, you need to go get evaluated by your family doctor. So that's why that was our point of our slide.
Good, yeah. So just to add to this point, so if a person got diabetes, and the doctor told you that you need to take insulin, would you stop taking the insulin, or would you take it? So you would take the insulin, right? All right, good. So would you make dua or not read Quran about for treatment of diabetes or not? You can just shout it out. Yes or no? Yes? Okay, good, great. So the same thing, the same principle we would like you to get is the same thing apply for mental illness. So any depression, any anxiety disorder, take your medication or take the treatment as instructed, but also read Quran, the supplication, the prayer, talk to your local imams, everything else that we do. So it's exactly, just because we don't see it, it doesn't mean that doesn't exist. So that's the main point of, talk therapy is here. It's one of the very effective ways of treating the depression. And if you want to learn more about it, talk to your physician. Every physician should have resources of the psychotherapist in your area that you live in that he can refer you to, or can refer someone you know to. Cognitive behavioral therapy is one of the effective form of type of therapy. It's my favorite actually, and it works really well in a short period of time. This is just a short list of where to get it. You start by your GP or your family physician. Every family physician are trained in picking up on depression, but you really need to talk to him or her and be honest about your symptoms. Your psychiatrist, if you have access to that. Your family physician also have access to that to refer you when cases are needed to be seen by psychiatrists, psychologists, social worker, counseling. You want to talk about the Muslim one?
If you maybe just go to so there's also resources. So if you need some more information about it, there's also some more resources like from CAMH, which is the Center for Addiction and Mental Health. They have a website and it goes through a lot of the symptoms just in case you need information. And then the Mood and Anxiety Disorders of Ontario as well, just in case you think that you have a loved one or yourself, you think that may be suffering from a mental illness, you can read some more information on those websites. And we have them at our booths as well. So in terms of some of the resources that the Muslim Medical Association of Canada does is we actually have the Inspiring Muslim Minds, which is what we're doing here, but we actually do a mental health talk alongside with an imam or a religious scholar so that you can get an understanding of the religious perspective on a mental health issue. So like we mentioned, we really encourage there to be an understanding of what mental health means in the Islamic context, because it is different and we have a different understanding than non-Muslims might about this as well. One of the things we wanted to go through is that we've been through quite a talk about depression, so it feels quite low. But I just wanted to end off on this to say that in one of the hadiths by the Prophet ﷺ, he says, Allah does not bring down an illness except that He will bring it a cure. And if you've met someone who has been depressed, you know that it is quite a difficult time for them, but this is something that always gives us hope in every field of medicine, that there is a cure out there. We just have to reach out for it, and we have to access the right cures. So just to end off, in terms of some upcoming sessions that we have from the Muslim Medical Association, we have one coming up on diabetes that will be at Masjid Toronto downtown on December 18th. And then we have one coming up on smoke cessation on December 11th. And if you want any more information, or you need resources, or you would like access to a Muslim counselor, psychiatrist, things like that, you can always go to our website, and you can also come up to our booths or email us and we can direct you, inshallah. And just a disclaimer, this is a talk, so we don't give you medical information in the intention of diagnosing you. You need to go to your physician for that. So this presentation is not meant to replace that. And that's it. Jazakallah, thank you very much for your kind attention. Thank you.
Jazakumullah khair, and Dr. Hassan and Dr. Arfeen. Very enlightening and informative indeed. We deeply appreciate and value your medical advice and knowledge that helps the community at large. And I'm sure a lot of you will have questions for them tonight. As they mentioned, they have 2 booths set up here. Please do ask them as many questions as you can. They will feel really welcome. Next on, let's break up a little bit of mood here. How about we proceed with giving away some prizes?